Hello, everyone, and welcome to our monthly community podcast. My name is Anais Mares, Health Promotion Specialist here with Siouxland District Health Department. And today, in honor of Diabetes Awareness Month, which is in November, we have two special guests joining us. Health coach Shannon Patton, who is an RN at Siouxland Community Health Center, and certified diabetic educator Denis Houts, who is also an RN at Siouxland Community Health Center. So welcome, both of you. Thank you for joining us today.
Thank you for having us.
So before we get started, would you like to tell us just a little bit more about what you do at the health center and maybe how long you've been working at the health center?
Sure. Like you said, my name is Shannon. I'm an RN. I've been at the health center for 5 years, and I've held numerous different titles there. But for about the last 10 months, I've been working as a health coach, so working with patients to help them manage their chronic diseases.
Okay. And I am Denis. I have been, I'm an RN. I'm also a certified diabetic educator. I have held the certified diabetic educator title for about 4.5 years now. I've been at the clinic overall about little over 22 years. Almost 23 years actually now. This year's flying by.
Wow. Yeah.
I worked on the floor as just a floor nurse for about 15 years, and then the last 7.5 years, I've been working as a health coach. So.
Okay, awesome. Thank you. So, like I mentioned, November is Diabetes Awareness Month. As we know, there are two different types of diabetes, type 1 and type 2, and it's important to differentiate between the two. Would you be able to tell us a little bit more about each one and the differences between them?
Absolutely. So you're right, there's a pretty big difference. Type 1 is an autoimmune disease, generally affects the younger population, so oftentimes you'll find children, sometimes young children, up to teens. It's really the most common age that people are diagnosed, and usually it's an abrupt diagnosis that they find out very quickly. And it's usually they find out they were sick. They find out that it's not just that they're sick, they actually have diabetes, and they become completely dependent on insulin. So it's not a diet situation. It is something that just happens to them. Sometimes there is some genetic components to that as well. But they have to have their insulin in order to live. Their body no longer produces that insulin. Without insulin, our body doesn't have any idea how to use the sugar that we eat. So it becomes very serious very quickly for those patients. So, yes. And then with type 2, that's typically diagnosed at a later age. Sometimes it's an acute diagnosis, but for those patients who see their provider on a regular basis, it's sometimes a more gradual thing. Generally and historically, it used to be something, I know when we went to school, it was something that we were always taught it's an older diagnosis. It's something you saw maybe in the mid-40s, starting maybe in the 50s. We started to look at that as a potential diagnosis. Unfortunately, now, due to diet and lifestyle, we're seeing more and more young people, and Denise and I are always shocked at how young it's becoming. It's becoming much more common in teens and even some younger. And that is something that, like I said, it's more gradual at times. We do see some patients that we even help them to prevent that from going all the way in. And patients differ all the way from being able to just manage it through diet and exercise, mild medication, all the way up to becoming semi-dependent on insulin in order to stay healthy. So big difference between the two.
Yes, definitely.
Yes.
Yeah. So one is more diet and exercise. The other is more, like you said, autoimmune.
Yep.
And
Yes.
body can't produce insulin and
absolutely
all that. So Siouxland Community Health Center does offer some chronic disease management for conditions such as diabetes and hypertension. Would you be able to tell us a little bit more about these services that the health center offers?
Sure. We are lucky enough to have 6 RN health coaches, and like we said earlier, I am a certified diabetic educator, and we do have 3 other diabetic educators on staff. And so we try to, help assist the patients, to really understand the diagnosis of, diabetes in the process, and, just really understanding the whole concept of it and, try to be part of their care team. And then, all of us health coaches have contact with our uncontrolled diabetic patients, at least monthly, either at their office visit when they're coming in to see their provider, or calling them on the phone. And, some of them will just come in and see the RN health coach for assistance, either with education or, if they're needing assistance with, medications or their meters, anything like that, just any way we can help them, access, care, prevent, cross any of those barriers out that they might have, anything that they might be facing. A lot of times they have problems just getting their refills or, transportation. A lot of them have different barriers. So we just want to make sure that they have everything that they need, their supplies, by making that contact every month. We try to do that. And a lot of times being uncontrolled, so to speak, is a lot of times due to the barriers that they have and not necessarily due to just wanting, not doing what they're supposed to do. So that's what we try to, prevent with that contact every month. And then, we can help them. A lot of them have, continuous glucose monitors. So we help, educate them on those and try to do that kind of, different education. We do some stuff with our insulin pumps. And then we also have a structured education program. It's accredited through the Diabetic, the Association for the Diabetes Care and Education Specialists. And then, it's a pretty long session. We can break it into multiple sessions, or we do a really long session if the patients like it. We've done it as group sessions as well. And that's just really, going even more in depth with education for the patient. And then we're lucky enough to also have a clinical pharmacist on staff. And he's a certified diabetic educator as well. And he works really close with us and with the patients. He regularly meets with them for like insulin changes. He does most of our insulin pump education as well, and with our continuous glucose monitors, he does any additional help that they might need there, and does a lot of the education on that stuff as well. And any insulin changes, he's able to do that. So
yeah, we're very lucky that we are able to work at such a team approach, and the providers really appreciate and seek out that help from our certified clinical health coach, or our clinical pharmacist, Daga, does an amazing job. So they really rely on him, rely on us, because they don't always have the time to be able to do all that education. And thankfully, we're given a little bit extra time to do that. And Denise is really good also at finding information in patients' languages. And because, of course, we serve a wide variety of populations and ethnicities. And so if I'm doing education with a patient and I'm talking about the kind of foods I might eat, they may not relate to that at all, and they may say that's not in my diet. Right. I had a woman the other day who said, she spoke Chinese, and she says, I don't eat American bread. So it was trying to relate to her what, she may eat bread in her what would be more bread type in her diet. So culture. Yes, so we work really hard at trying to. One thing we do at the health center, regardless of who you are, is meeting patients where they are. That's a huge theme that we have. So that may mean not only in their life situation, their financial situation, but also okay, how can we relate to patients? Yes. And patients love when we can hand them a stack of papers that not only is in their language, which we always make sure, can you read this language as well? So I want to make that assumption, but also their foods. So they're like, oh, okay, now this makes sense, and it's very rewarding to work with these patients and have them go, okay, thank you. They're so thankful for us to take that time and relate it to them and be like, okay, now I understand why this is important, and now I understand what I can do. And we are allowed to spend that extra time, like she said, to really explain to patients about what is this diagnosis, what does it mean. And some of our patients from other countries, their health literacy is very low, so they don't. We might walk into one room thinking everybody knows what diabetes is. They might not even know what is the pancreas, what is diabetes, what does that mean, how's it going to affect me. So that time we're able to spend with patients is really helpful in helping them to hopefully prevent those long-term complications down the road by really trying to just spend all that extra time with them. So if they come in, they have an appointment, we are stopping in. How are you doing? Let's build on that last conversation. We talked about this last time. How is that going? And that conversation with one patient versus the next can be totally different, different goals with different patients, but we try to work really one-on-one with them and meeting them where they are. One other program that we've been working on the last year is our diabetes prevention program, our DPP program. So, and that's a program that is accredited through the CDC, and we teach it through our own staff. It's a 12-month program, so it's working with patients who have been notified by their provider that you're getting really close. You're in that small window that they say your sugars aren't normal, but they're not quite high enough to be diagnosed as diabetic, but there's changes you could make right now to keep that from happening. So they've had a lot of success with that as well, and helping patients to identify what changes they can make to prevent all those complications down the road. So that's been really good.
And right now we're doing those classes in English and Spanish. So.
Oh, okay. When are those classes hosted?
Well, right now they've been changing different days just due to being able to find rooms for them and some different changes that are going on throughout the clinic. But we're getting ready. We start a class, and then that class lasts a full year. So once you're started in the class, we aren't able to add more people to the class, but we're getting ready to start new classes here towards the beginning of the year.
Yeah, January, February, we'll start new ones.
2023, and you'll have information as to,
Absolutely.
days, times.
Yep. Patients can contact the clinic, and we'll be happy to sign them up or even put them on a wait list right now and notify them as that comes around if it's something they're interested in.
And we usually try to do, class 0 or, the send-off class, and try to gather the time that's going to work best for the group, and then we kind of try to base the time off that. So we really don't know for sure when those classes will be.
Right, yeah.
Just kind of see what works best for everybody.
Yeah, people have different work schedules.
Absolutely.
Some people are available in the morning, other people in the afternoon. It just kind
absolutely.
of depends, like you said, what works best for the group.
And they tend to become pretty close in the group and really supportive of each other and share ideas, and this worked for me, and how are you doing? And so it's fun to watch them grow through that class.
So then that class is hosted at the health center location here in Sioux City?
There's one at each location. So one in South Sioux and one in Sioux City.
Yes.
Okay.
Yep.
All right. Well, that is great information to know. And then I'm just curious, do you post any of this information on your social media, Facebook, Twitter, Instagram?
If it is posted, which typically I can't say for sure, but they try to be fairly active on Instagram and Facebook.
Okay.
So hopefully they'll be able to push that out about, right before that.
And get that information out.
Yes, but if anyone is curious, they can feel free to contact one of us health coaches for sure. We'd be more than happy to talk with them.
Okay, perfect.
For hypertension, our diabetic program is very structured, and we spend a lot of time on accreditation and making sure that we have all the certifications that we can within our staff. But we've seen, I know in the short time I've even been in this position, we've seen a real increase in trying to help patients manage that high blood pressure, especially chronic high blood pressure, where the provider's like, I put on some medication, it's just not going anywhere. So we've increased, I think, our education that we do with patients, really trying to get patients to understand, what does a reading mean? What are those pressures? What is a normal number? We all tend to throw numbers at patients, and they're like, I have no idea what any of that. I don't know how to relate to that.
A lot of people don't even know what does the top number mean.
What are we reading? What does that indicate?
Where is that pressure from? What does it stand? What does it actually stand for? I'm trying to explain to them what your blood pressure is, and most people don't know.
Yeah, and how that can affect the rest of your body. And trying to relate it to patients in ways that they understand. So it's been interesting to just see that light bulb go off sometimes with patients and be like, oh, okay, wow, yeah, I really need to take care of that, don't I? And what it puts them at risk, and understanding how does your those risk factors that we can avoid, so our smoking, drinking, excessive drinking, alcohol, weight, versus the ones that you're born with. So maybe your ethnicity, your age, your family history. Sometimes we really have to explain to patients, maybe you're doing all the right things, but these are the risk factors you have. And so working really closely with them. So we have a couple different programs that we do. One, we have free blood pressure cuffs we hand out to patients. And they will we encourage them to write those down. We'll call them sometimes. They'll call us with what their numbers have been. And sometimes they'll bring those numbers back to an appointment. It's really helpful to see because, you come to the doctor's appointment, people get a little nervous, their numbers go high, and maybe they're at home, they're normal, or maybe they're not, so we're like, hey, we eliminated that. It's not just us. And then we also have we have what we call eye blood pressure cuffs, eye smart cuffs. So patients, because again, it's a free program for the patients. There's no charge to them. But those machines look very similar. They don't look much different at all, but they use cellular to transmit those. So then those readings go to a a portal, a website, and then we check those at least once a week. Like just today, I had a patient that called and he goes, hey, I don't know if you've looked at these today, but my numbers are getting really high. I'm just kind of nervous about this. Do we need to make some changes to my medication? Absolutely. We pulled those. We looked at them, talked to the provider, and she's like, you know what? Let's increase those. Let's check it in a week.
Right.
So it's very helpful. It eliminates particularly some of our patients who can't get here all the time.
Those barriers of cost for, their copay, transportation.
Transportation's a big one.
Total lack of insurance. There's just a lot, or their work schedule is they're a busy mom. They're taking care of, how many patients do we have there in that age group where they have children and parents they're caring for, and it's hard for them to get to the clinic and spend the time that we're asking
and with
them.
blood pressure, it's, monitoring it and med changes. So it's, coming in more frequently, and that's hard for a lot of our patients to do.
So they really appreciate that, that we're able to at least manage some of it. You eliminate a few visits at least in between if we're able to just monitor it. Sometimes we just call them and say, hey, things are looking great. You're doing a great job. Keep doing it. What else are you doing? Are you exercising? Are you watching? Because we tell them that as well. There's a whole package, right? And some patients don't want to take medicines. We're like, I understand that. Here's the things.
Here's what you can do.
And stuff like this, it works for I have patients that work out of town. They can't come in.
Yeah,
doesn't matter where you're at. You can still get those blood pressures. So it works out. And we also have this, for blood sugars as well that we can get. Their blood sugars, through cellular, look at them as well. And it works really nice for those patients that do, aren't able to come into the clinic sometimes. So.
And and the ones that maybe have a little bit harder time understanding when it's time to call us, and so we're able to watch that and be like, hey, I see your numbers are going up. Let's talk about when are you checking it? What are you doing? What are you doing at this time of day? So we are just lucky in the position that we hold that we're able to give that little extra time to help micromanage those high-risk patients.
Yes, definitely.
So, it works out really well. And the providers really appreciate the help we're able to provide.
And I'm sure the patients appreciate that as well.
Absolutely.
Yeah. Definitely. Especially because, understanding is a big part of it. Like you can go in and tell someone, hey, you have this, but if they don't really know what that is, they're not really going to either care or pay attention or so understanding.
If I don't know why I need to do something, I'm probably not going to do it.
Absolutely. Yeah. I think that's one of the great parts of our position is really, and we'll talk sometimes like, oh, I had this patient, like what would you have said? How would you have handled this? What do you think? Oh, this is what's worked for me in the past. But we're given that extra time to really go in and be like, let's really sit down and be like, what's going on right now? How
can patients get to know us too, which is nice. Then they learn, we have that trust between,
a lot of direct phone
calls. That's also huge. Right?
Yes,
also huge.
But it's a great relationship. Those are the reasons you go into healthcare, into nursing, is to establish those relationships with patients and help them become their best selves when it comes to their health. Yeah,
definitely. So Siouxland Community Health Center is hosting their second annual Diabetic Walk on November 14th. Can you tell us a little bit more about that and maybe how people can participate?
The walk is the goal is just to raise awareness about diabetes and to raise funds for our education diabetes education fund, and just to help reduce any barriers that patients might have for education. If anybody's interested in that, our deadline to sign up is November 7th. They can contact the clinic, either Rainey at the Siouxland Community Health Center if they're interested in signing up for a group, or if you're looking for just diabetes services, they can always contact ask for one of the health coaches.
And what is your number at the health center, or what is your direct number? Like if people have questions on either diabetic services or, hypertension.
They can just call the 712-252-2477, and then they would direct them to one of the nurses. The nurses, yeah.
Okay. Awesome. Is there anything else that you would like to add or think it's important for people to know before we close out?
I think the biggest thing is just, as far as the health center goes, understanding that we are the place people tend to go when they feel like either there's financial barriers. So we try to work as hard as we can with patients in their financial barriers, and there's not a lot of exceptions to that at all. So we try very hard to work with patients with that, whether there's language barriers, financial, whatever that might be. We just encourage patients if they don't have a provider or they are needing help, they're not getting the help wherever they are, to contact the health center. We're happy to help people. And like I said, we try to meet patients where they are. So
right.
No judgment, just our goal is to work with them to get their best health.
And we take, and patients that have insurance are welcome to come as well. A lot of people think that we don't take patients with insurance, but
insurance, no insurance.
No insurance, it doesn't
financial
matter.
Issues, no financial issues.
It doesn't matter, however,
Medicaid,
whatever you have.
Medicare, no insurance. We have the slide, which that is a unique feature that we have of being a community health center, because we are strongly federally funded. So that allows us to provide our services, even though our services are not very billable. They don't make money directly off our services as a health center. However, because we are so actively federally funded, we're able to provide these extra services to patients. We have a pharmacy right on site, and a lot of times our medications for our pharmacy are deeply discounted. We have lab services, we have x-ray, we have prenatal, we have mental health services, we have, what am I missing?
Dental.
X-ray, dental. So we have a lot of services, and we all talk amongst each other, so we're able to really coordinate that care for patients. So we have a lot of patients who come that don't speak English. We have a wide variety of translators, interpreters that are on site.
And they're growing, and we're hiring more in different languages all the time. So
we have a lot of Spanish. We have a couple Vietnamese. We have Pashto. We have Oromo, Tigrinya,
Somali.
What is our latest?
Pompey.
Looking for a Turkish interpreter. So we're always looking for, because it works out really well when we have them on staff. So.
And our community is constantly growing.
It is, yeah.
And we have plenty of patients that speak English that have insurance that are looking for a place to just get that coordinated care.
Yes,
so.
Also as well.
Yeah.
And then, as the health department, as the health center, we do get confused for each other quite a lot. So just to remind people, the Siouxland Community Health Center is on, remind me of your address? 1021 Nebraska Street.
Yes.
So it's on the left side of Nebraska Street, and the Siouxland District Health Department is 1014 Nebraska Street, which is on the right side.
Absolutely.
So just to clear that up, so there is no confusion or anything like that. But
we do have greeters inside our door that will direct you across the street if you're at the wrong place.
Yes.
And now, since we have become bigger, we have those greeters also to help assist patients when they come through the door, so they don't feel so overwhelmed too.
They'll let you know which direction to go inside the building.
Your appointment, make sure you're at the right building and assist patients.
Yes.
So
Awesome.
Because we do have the South Sioux City site, and then we have an off-site for the majority of our behavioral health, mental health services, which has been nice. Right. Patients really appreciate kind of the calm atmosphere of our off-site mental health service. So
yes,
absolutely. Okay. But we work very closely with the health department. So
we do, yes,
we're happy
on
to
a
have
lot
that
of
partnership.
So. Well, thank you once again, Shannon and Denise, for joining us today. If you have any questions, definitely feel free to give them a call. Feel free to also give the department a call, and we can always refer you there as well. And then our phone number here at the health department is 712-279-6119. Thank you.